You want good care? You want your doctor to listen, not to rush, to treat you like a human. But doctors are human too, and sometimes without meaning it, patients do make it harder, not easier, for doctors to help them. So let's talk. Let's talk about how to work with your doctor, not against them. Start time sounds basic, but it's not. Doctors often run late, and yes, some of that is their fault. But here's the other part patients don't realize. Even one late patient in the morning can cause a domino effect. Now, everyone's appointment is off track. One late patient, and everyone's appointment is off track. Everyone's waiting. And by the end of the day, the doctor's burnt out and behind. Everyone has to wait now. The doctor gets behind because of one 20-minute delay that was supposed to be 10. So here's what to do. Show up on time. If you're running late, call. Don't be that patient who shows up 12 minutes late to a 15-minute appointment and then expect a 30-minute consult. If you know you'll need more time, ask your doctor for a longer appointment. For example, talking about mental health, chronic pain, 5 unresolved problems. That's not a standard appointment. That's a double. And your doctor will thank you for it. Stick to 1 or 2 main issues at a time. Doctors want to help, but they can't fix everything in one go. When a patient pulled out a crumpled list of 8 symptoms, all vague, all undifferentiated, in a 15-minute slot, that's not efficient. That's chaos. Chaos for you rumbling through the 8 articles that is on the list, and confusing for the doctor with all of it together. The better approach is to say, I've got a few things, but these are the 2 main ones. If we have time, I'll mention the others. Or I'll book a follow up appointment. So that tells your doctor that you respect their time, that you are organized, and you want quality, not a rushed consult of many, many things, but quality management on the specific 1 to 2 problems. Be emotionally fair. Not every doctor is your therapist. Don't test your doctor. Ask them. Some patients come into the consult room with one goal to see, to test if the doctor is good enough. So they withhold symptoms, they quiz, they challenge every suggestion. That's not partnership, that's sabotage. That's sabotage. Instead, try this. I read something online. Can I run it past you? I want to understand this better. Can you explain this in plain English? What would you do? Would you do this if you were me? So these questions don't attack, they open up. Try not to collect doctors. Commit. Some patients jump from clinic to clinic, doctor to doctor, chasing the perfect answer. But here's the thing, consistency beats charisma. A doctor who knows your story, even if they are not the flashiest or the warmest, is better for your long-term care than 10 one-off experts. Pick someone you trust enough to walk with. Build that relationship. Don't make the doctor guess. Speak clearly and honestly. Doctors are trained to ask questions, but they are not mind readers. If you're not sleeping, say it. If you've stopped taking your medications, say it. If you're worried it might be something serious, say it. Say, I'm scared that this could be cancer. I'm scared that this could be serious. I know it might be nothing, but it's been on my mind. I feel like this is serious. Can we go over this again? So you're not being difficult, you're being direct. Understand and respect that some delays are about protecting your care. Yes, there are greedy doctors. Some overbook. They love the feeling of a crowded waiting room and keep people waiting just to be seen as important. Let's name it. It's real. It's frustrating. But many delays happen because a patient before you broke down in tears, or a critical result came back and had to be acted on. Next time your doctor is late, ask yourself, do I want my doctor to rush through my emergency when I'm the one falling ill or falling apart? Still not getting good care. Speak up with strength, not spite. There are dismissive doctors, definitely. There are rushed clinics. There are lazy answers. So, what can you say without escalating or being shut down? Here are some power phrases. What else could it be? What are you ruling out? What should I do if this doesn't improve? What happens if I do nothing? I've got two more questions. Is that okay? Just two. You're not nagging. You're steering the conversation. You're showing that you're engaged and not demanding. So your doctor is not perfect, but they're also not your enemy. The best medical care happens when patients and doctors meet in the middle. Clear, respectful, honest, not rushed, not chaotic, not adversarial. You want to be heard. Let your doctor speak. You want to be understood. Say what matters clearly. You want better care. Book the time. Ask the questions. Share the load. In healthcare, time is tight, but trust is everything. Start there.